Good evening and welcome. Thank you for joining us. My name is Matthew Vino. I'm Executive Director of the Group Insurance Commission. This is the first of 3 annual enrollment information sessions for active employees of the Commonwealth and our other related agencies. We'll be holding this and others throughout the next week and a half. We also hosted sessions for retirees last week. All of these sessions are being held by Zoom virtually, and we will post a video of the session on our website, which is mass.gov/GIC. We are holding these special sessions this year because we have a wider range of changes than we have in a typical year to our benefits for reasons that I will address this evening. We are at the same time finalizing our benefit guides, which will be available to you all very soon. Please keep an eye out for those. For the hearing impaired, we have CART services provided for this session. You can find a link for that in the Zoom chat. We also have ASL interpreters. To learn how to view them, we've provided a link in the directions also in the Zoom chat. Our plan this evening is to do a 30-minute or 35-minute presentation followed by an opportunity to answer verbally some of the questions that you have. So let's get started. So here is our agenda for the evening. Oh, sorry, first we're gonna start with a comment about questions. Sorry, if you can go back to the questions phase. You may submit questions at any time during this presentation using the Q&A tab of Zoom, which is typically located at the bottom of your screen. We will review your questions real time and respond to as many of them as we can in writing, also in the Q&A tab of Zoom. With such a large number, we may not be able to get to every question this evening, but we'll do our best. And when we finish the presentation, we will verbally address questions that we have received that we think will be of general interest to everybody. If you have a question that is specific to your coverage, including personal details, I'd ask you, rather than putting those in the Q&A tab, that you contact us directly so that we can preserve your privacy. You can use the phone number and website for the contact form that you see here on our slide. And as you'll note in the bottom, if we do have GIC coordinators from any of our agencies, please know that you will have information coming to you very shortly, training information and other materials that are coming. So if you can go back to the agenda slide for a moment. So this is our agenda this evening. We'll start with a few brief comments about why we're here today. Then we'll jump right into details about our health insurance plans for active employee coverage for the coming annual enrollment. Then we'll speak briefly to changes in prescription drug coverage and flexible spending accounts. After that, very briefly, we'll touch on dental and vision benefits in our employee assistance program. There are no changes to dental, vision, or our EAP program. Then we'll move to a few tips on how you can prepare for annual enrollment before we get to the verbal question and answer session. Go to the why are we here today slide. Great. So why are we hosting a session today? As I mentioned earlier, this is an unusual year for the GIC, and I want to explain why that is the case. So first, as we always do, we want to start on the next slide with our mission, which I hope is familiar to you all. As you can see in the bolded format, we always put our members front and center of the work that we do with a commitment to provide high quality and affordable insurance benefits. And in order to meet that mission, we provide this full suite of insurance benefits noted on the right. More specifically, we're here today because annual enrollment is just a few weeks away. It will launch on April 5th and will close on May the 3rd. This is the time when anyone that's eligible for GIC coverage can make changes to their insurance policies for coverage starting this coming July 1st. We also want to make it as easy as possible for you to interact with the GIC. So we've been hard at work over the last several years to create an online member portal called MyGICLink. This is now available to all of you that have a valid email address that you can use to register for use of the portal. You're not required to use the portal during annual enrollment or at any other time. We will continue to accept paper forms, and our staff are always just a phone call away. But through the portal, you can do a number of things very easy and simply and quickly. You can review your current benefits, update your information, add or change beneficiaries. And during annual enrollment, you'll be able to compare different options for health insurance that you're eligible for, and to actually complete enrollment. So please, if you have the opportunity to check that out, it's a great tool for you. So as I said, there are a number of changes to benefits this year, and I want to say why that is the case. First of all, the GIC is required to recontract at least every 5 years with all of the companies that we work with to provide your benefits. And generally, it's a good practice to reprocure those benefits anyway. Second, as folks can well appreciate, the healthcare system is constantly evolving, and our strategies to keep up with those changes also need to evolve so that we can deliver on our mission to you. One big change that you're likely well aware of is the merger of two of our longstanding health insurance companies, Harvard Pilgrim and Tufts Health Plan. Also, another of our plans, Always Health Partners, has changed their name to Mass General Brigham Health Plan. Aside from our health plans, hospitals also continue to merge into ever larger systems. This makes healthcare more expensive and more complex. And we always have new drugs that continue to come to the market. These can be life-changing for you, our members, but they also come at an enormous cost. So with all of these challenges, we have to adjust our ways of dealing with them, and that's why we're making some changes this year. Finally, when we do recontract, especially with our health plans, it's a good time for us to also make adjustments to different features of the plans, including member cost sharing, co-pays, and deductibles, and the like. So add all that up, and this is a year of more than ordinary change. So thank you for joining us to learn about that. So on the next slide, you'll see high level, these are the companies that the GIC will be working with to provide coverage for you starting on July 1st, organized by our different plan categories. I'll speak to the changes that are incorporated here in the next couple of slides. But quickly, for those of you who live outside of New England, we have a new national plan offered by Harvard Pilgrim Healthcare. Sorry, go back to the previous slide. There you go. For those who live in New England, you can choose between broad network plans offered by Harvard Pilgrim, Unicare, and Mass General Brigham Health Plan. Health New England will continue to be our regional plan available to residents of Western Massachusetts. And Harvard Pilgrim and Unicare in the lower right here will continue to offer limited network plans. So as you can tell from if you can go to the next slide. As you can tell from the prior slide, many important elements of our plans are not changing. So we will continue to offer a variety of choices, work with many of the same insurance companies, though there are some changes to specific plans, which I will get into. We continue to offer several different types of plans. We continue to offer HMOs, which feature a closed network of hospitals and doctors with a designated primary care physician. We continue to offer point of service plans, which are similar to HMOs, but offer broader access to hospitals and doctors outside of the network. And we still offer our indemnity plans, which give broad access to all providers. We also continue to offer both broad and limited network plan options for those with who desire a variety of choices. And while we are making some changes to co-payments that I'll talk about more in this presentation, we are not implementing broad cost shifting to members through higher co-pays, deductibles, and out-of-pocket maximums. Finally, we are making no changes to dental, vision, life insurance plans, or to our employee assistance plan. So briefly, we are making no changes to Health New England. Again, this is the plan available to residents of Western Massachusetts and those who reside just over the border in Connecticut. So while a lot is staying the same, there are a number of changes to active employee plans that you should consider as you make decisions during annual enrollment. First, with the merger of Tufts and Harvard Pilgrim, Tufts will no longer offer health insurance plans to active employees and their dependents. Second, we've made some changes that will mean some of the options that are available to you are different in the coming year, depending on where you live. Again, I'll speak to that in more detail. Third, we've made a few targeted changes to co-payments in our plans. And finally, the specific names of the specific healthcare offerings will be different. So I'll talk about each of these in turn. So as I mentioned, Harvard Pilgrim and Tufts recently merged into one company called Point32 Health. As a result of that merger, not any decision made by the GIC, Tufts will no longer be offering Tufts Navigator. So if you are in Tufts Navigator today, you will continue to be covered under that plan through the end of June. But during annual enrollment, you will have to select a new plan, or the GIC will make the decision for you and put you in a similar plan, in this case, Harvard Pilgrim Explorer plan. The good news is that you have a lot of options depending on where you live. Harvard Pilgrim, Health New England, and Unicare continue to offer other broad network plans similar to Tufts Navigator. Also, for those looking to save a little money on premium, you can consider one of our narrow network plans offered by Harvard Pilgrim and Unicare. And you also have another broad network plan option through Unicare Total Choice. At the GIC, it's really important to us that no one goes without coverage. So as I noted, if you're enrolled in Tufts Navigator and you do not actively choose a plan, we will default enroll you into Harvard Pilgrim Explorer. This is the most similar plan we have on our product shelf, and that's why we chose this plan as the default option. But please be aware the premium for this plan will be higher than Navigator, which is why it's especially important this year to actively shop among your options. We strongly encourage you to make this choice rather than leave it to us to make for you. If you are in Tufts Navigator and you've evaluated Harvard Pilgrim Explorer and it meets your needs, we're happy to enroll you in that plan. On to the next one, which is Tufts Spirit. So Tufts Spirit is one of our narrow network plans. As with Navigator, with the merger of Tufts and Harvard Pilgrim, this plan will no longer be offered through the GIC for the coming year. Again, if you're in Tufts Spirit, you will continue to be covered in that plan through the end of June, but during annual enrollment, you'll either need to select a plan or the GIC will select a plan for you and default enroll you. That will depend on where you live. It will either be the Harvard Pilgrim Quality HMO or the Unicare Community Choice Plan, both of which are very like limited network plans. As I said in the prior slide, though, if you're If you're defaulted into one of these other plans because you didn't choose a plan, you may have a higher premium than you would like. So this is a great year to evaluate all of your options. On to Harvard Pilgrim Healthcare. They will continue to offer both their broad and limited network plans, and they will continue to operate much as they are today. They will have different names. The Independence Plan, which we offer today, broad network plan, will be called Harvard Pilgrim Explorer. And Primary Choice, the limited network plan, will be named Harvard Pilgrim Quality, HMO. Other than the changes to the names, these plans will continue largely as they exist today. On to Unicare. So the Unicare Basic Indemnity Plan that we offer today is being essentially replaced by two separate plans, depending on where you live. A new plan called Harvard Pilgrim Access America will be the plan for all members who reside outside of New England. And Unicare Total Choice, again, very similar to Unicare Basic, will continue to be available to those who live in the 6 New England states. I'll talk more about each of these in turn in the next 2 slides. So starting with the plan for those of you who live outside of New England, again, you've been covered by Unicare Basic in the past. This has been our most expensive plan, but as a result of our recontracting process, we're pleased to provide a less expensive plan with a lower premium, even than you pay today with Basic, offered through Harvard Pilgrim, called Access America. This new plan will offer similarly wide access to hospitals and doctors, but a lower premium and with no changes to co-payments, deductibles, or out-of-pocket maximum. For those of you who have been enrolled in Unicare Basic, you also know that for many years, there has been an optional component called CIC, or Comprehensive Insurance Coverage. You also know that you as the member have paid 100% of that additional cost. The state has not traditionally covered the percentage that they would typically pay for your overall premium. As of July 1st, we are folding the member pay-all cost into the plan's regular premium. What this will mean is that the state will now pick up its share of the cost. The coverage will continue to be as it was under Unicare Basic with CIC, so similarly broad comprehensive coverage. This is somewhat complicated, particularly for those of you who have not been in this plan, but the short story is that it means that this is the same great coverage that you've had, but the state will help pay that extra cost of that program. It's important to note that for this plan, eligibility is determined based on the address that we have on file for you. Again, this is a plan for those who reside outside of New England. And if you've lived outside of New England for 6 months plus 1 day, you will be eligible to enroll in this plan. So please make sure that the information that we have on file for your residents is accurate if you're looking to enroll in this plan. On the next slide, for those of you who reside in New England and you've been on Unicare Basic, this plan will now be called Unicare Total Choice. We'll continue to have the same broad access to doctors and hospitals, but we are making a few positive changes to the plan to make it easier and simpler to use. Again, as I noted with the out-of-area plan, we're removing the member pay-all portion for the CIC coverage and folding it into the plan's premium and coverage. Second, for this plan specifically, we're doing away with tiered co-payments, replacing them with flat co-payments. Next, we move on to Always Health Partners. As I mentioned earlier, they have changed their name to Mass General Brigham Health Plan. I want to make sure that you understand, all of you, that just because the plan has Mass General Brigham in its name, it is not the only plan that gives you access to Mass General Hospital or Brigham and Women's Hospital. You can still enroll in other broad network plans and have access to these hospitals and affiliated doctors. Second, in the past, this plan has not been available to those in some parts of Western Massachusetts, but we are now able to offer this plan to any resident of Massachusetts, no matter where you live. Finally, there is now a statewide, since this is now a statewide broad network plan, it will have the same co-payments and deductibles as other plans in this category. This will mean higher co-payments and a higher deductible. So if you are in this plan or are you interested in this plan, it's important to evaluate whether it still meets your needs with those changes. Unicare Plus, finally, Unicare Total Choice and Unicare Community Choice will remain unchanged. We have made a few adjustments to co-payments to a subset of our Unicare plans. First, for all Unicare plans, we've added co-payments for eye and gastrointestinal procedures when you receive them at a freestanding facility, as well as co-payments for outpatient procedures. And finally, and this is specific to Unicare Plus and Community Choice, we've made a minor adjustment to co-payments to non-preventative primary care visits. So we've covered a lot with the plans so far. I here wanted to bring together the changes, all of the changes that we're making to member cost sharing into one slide. Again, the details that you see here will be made clear in the benefit guides that will be posted on our website, and I encourage you to review all those. I should also note that, as I mentioned earlier, all of these slides will be available on our website immediately after this session, and that's mass.gov/GIC. So before we get into premium rates for these plans, I want to share this table. Again, this will be in your benefit guides. This shows each plan that we offer today in the middle column, eligibility for those plans on the left-hand side. And on the right-hand side, these are the plans that you will be default enrolled to if you do not act to choose your own plan. So when you get your benefit guide, please pay close attention to this table. So now to round out the health plan changes, we'll just say a few words about how premiums are changing. So there's a lot on this slide. I apologize that we had to use such small fonts, but again, you can find this slide deck and this slide in particular on our website. Here we wanted to show the full cost premiums for each of the plans for fiscal year 24 and how they're changing from this year. So on this slide, you'll be able to see the percentage increase for plans that we will continue to offer. I want to be clear here. These premiums shown on this slide is not the amount that you pay, which we'll show on the next slide. This is the total cost of the plan, which combines what the state and you pay for. What I'd like to draw your attention to here is the fact that while a few premiums are increasing more than 9%, most are increasing by much less, and some are actually decreasing. That's one more reason that this year it's important to do your homework during annual enrollment, review your decision guide, and make the choice that's right for you. And finally, on the health plans, this slide shows what you will actually pay based on your premium contribution percentage, which is determined by your date of hire, for each plan that we're offering this coming year. As I mentioned before, this table will be included in your benefit guide. The rates here are what your monthly contributions will be. So the amounts deducted from each of your paycheck will need a little bit of math. If you're paid twice a month, you can divide this by 2 to get what will come right out of your paycheck. As noted here, if you're a municipal employee, it works a little bit different. So you'll want to reach out to your city or town to find out what your specific premium deductions will be. So I just want to pause again to remind you that you may submit questions at any time during the presentation. In the Q&A tab of Zoom, we will review your questions and respond to as many of them as we can, and we'll address verbally those that we think will be of interest to a broader audience after the presentation. Again, if you have questions about your specific coverage, please don't put that in the Q&A tab, but contact us directly based on the phone and web link that's provided here. So now let's move on to a change that's coming to your prescription drug benefits for those of you enrolled in active employee plans. CVS Caremark, as you'll see on the next slide, will replace Express Scripts as the company to provide your prescription drug benefits in the coming year. So starting on July 1st, you will need to use your new CVS Caremark ID card when filling prescriptions. There is nothing for you to do during annual enrollment as it relates to this change. Your coverage will automatically be switched over to Express Scripts. CVS Caremark will reach out to you with a welcome packet and your new insurance card. There are a few important things for you to take note of. If you have a recurring prescription, we recommend that you bring your new insurance card to the pharmacy to make sure that they have the new information. Second, if you or a family member are on long-term medications, such as for high cholesterol, you will receive a letter from CVS Caremark asking how you would like to receive those refills in the future, whether you want them home delivered to you by mail or whether you want to get them at the local pharmacy. And as always, if you have questions about your specific coverage, you should contact CVS Caremark directly at the phone number on the back of your new card. Next, we'll move on to flexible spending accounts and changes we are making there in the coming fiscal year. So bear with me while I say a few words about our flexible spending accounts, which are commonly referred to as FSAs. An FSA allows you to set aside money pre-tax from each of your paychecks throughout the year, and you may use those funds to pay for qualifying medical expenses for medical services or for childcare. And it allows you to plan for these expenses and save some money for them. Currently, the GIC's program for FSA is administered by a company called Benefit Strategies, or VOYA. But beginning on July 1st, this will change and the benefits will be offered by a company called Total Administrative Services Corporation, also known as TASC. So you can use, let me just say a few words about the healthcare FSA and the dependent care FSA. So you can use your healthcare FSA to pay for healthcare related expenses that are not paid for by your insurance plan. So co-pays, deductibles, or dental visits, vision expenses like glasses, and a number of other healthcare expenses. For the healthcare FSA, you can put aside a minimum of $250 or up to a maximum of $3,050. For the dependent care FSA, you can use these dollars to pay for eligible childcare expenses or expenses to care for a disabled adult dependent. Again, here, the minimum the IRS allows is $250 to be in this account, or $5,000 as a maximum. It is important to note that in exchange for the tax benefit of these plans, the IRS enforces a use it or lose it rule. So you must use these funds by the end of the plan year, or you lose that money subject to a grace period. For funds dedicated for the FY23 plan year, that's the plan year we are in right now that runs through June, that grace period will run for 75 days after the end of the plan year. So you'll have until September 15th to incur new expenses to be paid from those current year funds. You will then have an additional 30 days after the grace period to submit a claim for those expenses. So you'll have until October 15th to use to make sure that you get reimbursed for those funds from FY23. Sorry, that's a lot to go over, but the FSA plans are a really valuable tool for managing your healthcare expenses. On to the next slide, very briefly. Here you'll find all of the ways you can enroll in and manage your FSA elections through our new partner in this task. On the next slide, again, bear with me a little bit. For those of you who are enrolled in the FSA or are looking to enroll in the FSA, there are a number of things that you need to be aware of. If you're not interested in the FSA, you can probably tune me out for the next couple of minutes. As I mentioned earlier, there is a grace period for funds in the flexible spending account for the current fiscal plan year, fiscal year 23. This grace period will be administered by the new company that we're working with starting in 24. So that is TASK. The two companies, Benefit Strategies and TASK, are working closely to transfer any balances from the soon-to-be ending fiscal year into the new fiscal year. And in order to do that, there will be a brief blackout period after the plan year ends, but during the grace period. So these funds for that brief period will not be available to you. This starts on June 30th and will run till approximately July 18th. So there's a lot more information here on it'll be on our website. I'd encourage you to review those materials for more details about this transition period and the blackout period. But once you receive your new task card, it will be active for your fiscal year 24 plan starting on July 1st. Lastly, I just want to note that for those of you who are enrolled in commuter or parking plans with the Commonwealth, with Benefit Strategies, as you may know, those are not administered by the GIC, and our understanding is that vendor is not changing. So if you have a commuter or parking plan, you'll continue to use your Benefit Strategies card. Thanks for bearing with me on that one. So moving on to dental and vision benefits for fiscal year 24. Dental and vision benefits will continue to be available to members who are not covered through your unions, or those of you who do not have another dental or vision plan through the Commonwealth. There are no changes to the benefit designs this year, no changes to cost sharing. However, you will want to review the premium rates in the benefit guide as they have increased slightly from the current plan year. You'll see the premiums at the bottom of the slide here. Now on to our employee assistance program. This I'll be brief about. You may have heard about Mass4U. This is our employee assistance plan administered by a company called Optum. It's available for all employees who are eligible for GIC benefits. You do not have to be a GIC member to take advantage of this. They offer a variety of free confidential support tools. They provide virtual therapy visits in addition to what your health plan covers. You can get consultations on legal matters and mediation, on financial matters like managing your debt, and if you're facing a foreclosure for your home, and a variety of other services. So if you're not familiar with Mass4U, I encourage you to learn more about it at our website. One last reminder that you can submit questions at any time during the presentation in the Q&A tab in Zoom. So the final section before we move to address questions verbally, as I've said many times, it's important to be engaged, especially this year regarding your insurance benefits. And we want to provide you a few tips on how you can prepare for annual enrollment. So here we provide a brief checklist with the key steps for you to take. Number one, plan ahead to make sure that you get us your changes before May 3rd when our annual enrollment ends. Number two, check with your insurance company, your health insurance companies that you're eligible for, the plans you're eligible for, to make sure that their networks of doctors and hospitals include those that you want to continue to see and other benefits that they have to offer. Contact your doctor to make sure that they accept the insurance plan that you're considering enrolling in. And if you're turning 65 soon, please be aware that there are a number of steps that you need to take. And I encourage you to visit the GIC's website, where there's a wealth of information about what you need to do. Finally, when you're deciding on which plan is best for you, it's important to consider at least these factors. Number one, location. Where you live is an important factor to determine which plans you're eligible for. I've mentioned that a few times in this presentation. Number two, what coverage type works for you? What kind of coverage is going to meet your needs? Is broad access to providers most important? Or is it premium cost that comes from your paycheck that's most important? Network of doctors, as I mentioned, you need to check to make sure that the doctors and hospitals you want to continue to see are included in the health plan's network. And if they are, what cost share tier are they in? That will determine what you pay for a copayment. And how much are you willing and able to pay? The GIC offers plans with broad access, higher copays and higher premiums, but also limited network plans that have a smaller network of providers, but also have lower copays and lower premiums. It's important to decide which combination of those factors is most important to you. So we'll close with this next slide for your reference so that you can have the phone numbers and websites for all the companies that we work with. We will bring this slide back up again during the Q&A section. It has a number of different important resources for you. And with that, we will move into questions and comments. I want to thank you for attending the session. To learn more, please be aware that there's a lot more information coming your way beyond this session. Your current health plan that you're currently enrolled in will be reaching out to you. As I mentioned, you'll soon receive the benefit guides with loads more detail about annual enrollment. And as always, you can check the GIC's website for most anything that you need from us at mass.gov/GIC. So with that, we will move to the part of the presentation where we'll verbally take some questions we think will be of broad interest to those who are attending. And for that, I'll hand it over to our Chief of Staff at the GIC, Emily Williams.
Hi, Matt. Thank you. So before we get started on the Q&A, one of the most frequently asked questions that I wanted to address is when the materials from this presentation will be available. So again, the slide deck will be available on GIC's website after this presentation, as well as a recording will be available on our YouTube, and are already available on the GIC website, mass.gov/GIC. And we also did want to clarify that for members looking for information about when they should contact their plans to find out what doctors are covered, they should do so during annual enrollment. So after April 5th, the plan's coverage will be updated. And with that, I will... Again, during this, I encourage all members to continue asking questions utilizing the Q&A function. We do have staff available who is answering questions as quickly as they are able to. And the most frequently asked questions that may appeal to everyone who is viewing this presentation, I will keep an eye out for those and ask those so that we can answer them live. So we have a question about dependents. If you have a dependent who lives outside of New England, but the enrollee lives within New England, what are their plan options?
Paul Murphy, you want to take that one?
Sure. If the member resides within New England, the plans that'll be available, Unicare Plus, Harvard Pilgrim Explorer, and Unicare Total Access, will continue to cover dependents that live outside of New England. So there's no change. Only when the member resides outside of New England, the member will have to enroll in Harvard Pilgrim Access America. So we will continue to cover dependents that reside outside of New England if the member resides within New England in plans such as like Total Access, Unicare Plus, and Harvard Pilgrim Explorer.
Thank you, Paul.
Great, thank you, Paul. And I do see a couple of questions coming in asking about benefit guides, and I wanted to clarify that this year benefit guides will not be mailed to members. They will be available on our website. So we do encourage you to go to our website, mass.gov/GIC, to view your benefit guides options. And Matt, we have a number of questions asking if we can go over what CIC is again and what is happening there.
Yeah, it's a little complicated. And again, those of you who have been in Unicare Basic are more familiar. But to have full coverage that's comparable to other broad network plans for the wide range of services that you'll need, for a variety of reasons that relate to state statute, we've had to have this separate portion of the premium that the member pays the entire cost of on top of your regular premium. So what that means is that an individual who pays their premium, the state shares the cost of that depending on your date of hire, but no matter when you were hired, you pay the full cost of this additional program called CIC. So with the change we're making this year, that will no longer be the case. You will get the same coverage that you've had with the CIC plan under Unicare Basic, but now the state will pick up its portion of the extra cost. So in essence, you will no longer see in the Unicare Total Choice Plan or the Harvard Pilgrim Access America plan, you will no longer see CIC as a separate item. It will be incorporated into your plan. Same great coverage, a little bit less cost for you.
Great. Thank you, Matt. And we have another question about areas of coverage. If you live outside of New England, are you required to enroll in the Harvard Pilgrim Access America plan?
Yes. So if you live outside of New England for 6 months plus a day or more, the plan that you have available to you is the new Access America plan. It is essentially replacing Unicare Basic as your plan. Good news is we're able to get you a lower premium than you had with Unicare Basic last year. That's as a result of the contracting that we did over the last year. And you'll see that on the top row on this slide that one of my colleagues just brought up.
Thank you. And if you are in a plan that is not changing, such as always, it's changing in name, but you want to stay with that plan, do you have to do anything? Do you have to take any action during annual enrollment?
If the plan is continuing, you do not have to take an active step to change the plan. I would say this is the slide that you want to keep an eye on. the example that was referenced, Always Health Partners, it's only changing its name. There are some changes to the plan design, as I mentioned. There are higher co-payments and a higher deductible. The network will not change. So it is important for you to evaluate whether the changes that we made to the plan, with those changes, it still meets your needs. You may have some less expensive alternatives available to you with a lower premium.
Thank you. And if a member is going to be traveling outside of the country, just for a vacation, a limited time, will they be covered, or what types of services will they be covered for under all of our health plans?
Yeah, again, I'll ask Paul Murphy, our Director of Operations, who's been here for over 3 decades, going on 4 decades, to answer that question. Paul?
Thank you, Matt. If a member is traveling anywhere in the United States or out of country, the member is covered in all plans for emergency services. So they are fully covered for emergency services outside of the US or within the US under all of our plans.
Thank you, Paul.
Thank you. And we have a number of questions now about the new pharmacy benefit administrator. The first is, can I continue to use a non-CVS pharmacy for my monthly prescriptions?
That's a really good question, and I should have made that clear. And I may ask my colleague Janine Dewar, who manages our relationship with our manages the pharmacy benefit, to say a word here too. But the answer is yes, you may still use non-CVS pharmacies, even though the card that you will get in the mail and the new company we're working with is called CVS Caremark. So CVS Caremark is the pharmacy benefit manager that we're working with. CVS Pharmacies as a retail pharmacy, part of the same overall company, but we're not changing your access to a broad range of retail pharmacies by making this change. You can still go to Walgreens or any other retail pharmacy that's available to you. Janine, is there anything that you wanted to add to that?
I think you captured the gist of it, but I would advise you to respond to any letters that you receive from CVS. For instance, if you need to let them know that you want to use a different pharmacy than CVS for maintenance medication, which is long-term medication, for instance, high blood pressure, or medication used for high blood pressure, or things that you are taking continually.
Thanks, Janine.
Thank you. And a follow-up question is, if a member has a prior authorization already in place for a prescription, will they need to take any action to transfer this to CVS?
Well, that's another question I would ask Janine Dewar to speak to, if you would, please.
They'll be transferred over to CVS. If you do have if you're on a controlled substance, you'll need a new prescription from your doctor. And again, you'll receive information about that.
Thanks, Janine.
Thank you. And if I see a number of questions asking if we can go over the difference between Unicare Plus and Unicare Total Choice.
Yeah, I don't know if we have a slide that compares those two, but I think I would ask Cameron McBean, who manages our relationship with most of our health plans, if you could say a word or two about that.
Sure thing. The focus was on the difference between community choice and plus, or total choice and plus.
Total Choice and Plus.
Okay. Total choice is meant to, the reason it's our most expensive plan is it has the least restrictions on which types of providers that you can see. There is only one copay for a specialist, so it's not a tiered product, meaning that you can go see any provider and it will be the same cost regardless. That is the big difference. The Plus plan is tiered, so if you go to the more expensive facilities around the state or within New England, such as Mass General, you will pay a higher copay at those facilities or with their affiliated physicians. Those are the biggest differences between the two products. And then as far as community choice goes, which is our narrowest focus, it offers, you know, a relatively restrictive choice of hospital facilities that you can see and pay a low copay at for services. You can still go to a higher cost facility such as Mass General, but you will pay significantly out of pocket because there is a 20% coinsurance that applies if you go to a non-community choice facility. So those are the three big differences. Community choice is fairly restrictive in terms of which providers or facility, or most specifically facilities you can go to. Plus is a broad network tiered product that is available throughout New England. And Total Choice is our least restrictive plan, and it's the one that is available to residents not just of New England, but if anyone lives in a U.S. territory such as Guam or Puerto Rico, or in a foreign country, Total Choice is the only plan that offers significant benefits internationally.
Thank you, Cameron. The reason that that's a long answer is that there are a number of variables, and for those who are really looking to distinguish between those two or any two plans, your benefit guide will include all these details. So really encourage you to review your benefit guide.
Thank you. And we have another question about coverage areas. This is different than the previous question, which was only if you are traveling for a short amount of time outside of the United States. This question is if your place of residence is outside of the United States, what plan option is available for you?
Total Choice.
Yeah, that's Unicare Total Choice.
Thank you. And I have a follow-up question to the pharmacy questions. Will there be a new specialty pharmacy with the change of PBM?
Yes, there will.
Yes, it'll be CVS specialty. So CVS will work with our members to make sure that that transition is smooth. If there are any issues that need to be escalated, please contact the GIC and we'll work with you and CVS as well.
Thank you, Janine. And I have a question clarifying the plan year for the FSA plan, the flexible spending account. Can you clarify what the GIC's plan year is?
Yes, for the last 5 years, the GIC's flexible spending accounts have operated in sync with the state's fiscal year. So it's on the same cycle as all of our other plan years. So the new plan year begins July 1st. The previous plan year would end June 30th. The grace period, which is 2.5 months, runs through September 15th. That's how long you have to use the previous year's funds. And then there's an additional 30 days filing deadline that you can submit claims for reimbursement as long as they were incurred within the plan year or grace period. We saw a number of questions about the blackout period and the changeover between the administrators from Benefit Strategies or Voya to Task. Just to clarify again, there will be that blackout period. Task will handle the administration of the of the grace period, as well as the filing deadline. So once July 1st rolls around, any claims that you submit will need to go to task. Your benefit strategies debit card, while it still will remain active if you participate in the state's parking or commuter benefits, it will no longer provide you access to your FSA funds. The blackout period is necessary to make sure that benefit strategies can provide accurate reconciled information on account balances to task. We'll then load it into their systems. If you have any claims during that 2-week approximately blackout period that's expected to end on July 18th, you can use your new task debit card if you participated in both years, in the current year and in the upcoming year. And the new task card will draw on your available fiscal 24 balances first. Once the blackout period has ended and task has all that fiscal 23 account information, they will go back and readjudicate any claims that can apply towards your fiscal 23 balance, assuming you have one. They will do that automatically.
Thank you, Cameron.
Thank you.
Thank you. And I have seen, if we can go back to the premiums slide, I just see a number of participants asking to view that again. Thank you. And we have had a number of questions asking where members will be able to find the information about what tier their doctor or hospital will fall into.
Can you repeat that question, Emily?
Yep.
Sorry.
Where will members be able to find the information about what tier their hospital or doctor falls into? So for the tiering, tier 1, tier 2, tier 3.
That's a good question for Cameron. Go ahead.
Yeah, that information will be available on the insurance carriers' websites by the start of annual enrollment. So no later than April 5th. Some of them are likely to be live by April 1st. We're still working on getting those details finalized. And we also didn't want to have conflicting information up there available for folks prior to annual enrollment. So that information will be there by the time annual enrollment begins, but it is not available just yet.
Thank you.
Thank you. And we have more pharmacy questions. If a member wants to continue receiving their 90-day prescription from a non-CVS pharmacy, what steps will they need to take?
CVS will reach out to you and let you know if you need to confirm with them about the pharmacy that you prefer to fill that prescription.
Thank you, Janine.
Thank you. And I see a number of people asking if we can go to the plan mapping slide again. And if you can just talk for a minute, Matt, about which plans due to the merger will no longer be available again.
Yeah, for active employees, there are 2 plans offered by Tufts today that will no longer be offered for the coming fiscal year through annual enrollment. That is Tufts Navigator, our broad network plan. That's a point of service plan. That plan will be retired at the end of this fiscal year on June 30th. And the Tufts Spirit limited network plan will also be retired.
Thank you. And I just wanted to remind members again, I see a lot of members asking if this recording will be available, and it will be available on the YouTube website, the GIC YouTube website, following the conclusion of tonight's session.
If I may pick up one question I see in the chat, which we frequently get. What is the difference between HMO, indemnity, and PPO plans? So an HMO plan, Health Maintenance Organization plan, as I mentioned, is a closed network of providers and hospitals. So you can only see those providers and hospitals that are in the health plans network. A PPO plan or POS plan, which is similar, allows access to providers that are not within the network, but you pay a higher copay or deductible for going to those providers. An indemnity plan provides broad access, really the broadest access to all providers. I did see a note, a comment that someone made in the Q&A about behavioral health providers, that the indemnity structure within the Unicare plans doesn't carry through. I would encourage you to contact Unicare to get more information about that.
Great, thank you, Matt. And we have members asking if they are having trouble accessing the portal, or if we can talk again about the best way to sign up for the portal to view their benefits and make any changes during annual enrollment.
Yeah, Paul can correct me if I have this wrong, but all of our members now have access to the portal. If you have an email address, you can do that. I would encourage you to go to the GIC's website for the link to register for the portal. Paul, is there anything more that you would say to that about accessing the portal?
No, it's correct, Matt. You can go to our website and there's a tab for MyGICLink. When you click on that, there's a page that will come up, allow you to register for the portal. If you have already registered and forgot your password or PIN, there is a password or PIN request that you can reset. But if you're having difficulty registering for the portal, you can always contact our office directly and we can help you with registering for the portal.
Thank you, Paul.
Thank you. And Matt, we have had a number of questions asking if we offer a member plus one plan as opposed to a family plan.
Yeah, so currently we offer an individual plan and a family plan. The questioner is probably aware that some employers also offer an individual plus one plan, which sort of falls in the middle. We have evaluated the possibility of adding a member plus one plan, and at this time, we are not proceeding to add a member plus one plan. Generally, what would happen is that an individual plus one plan would have a premium somewhere in the middle. Our analysis based on our membership doesn't show that to be particularly the case. We do continue to monitor this, but at this time, we're not contemplating adding an individual plus one.
Thank you, Matt. Sorry, their questions are rolling in still, and I'm still looking through them.
you're doing that, I'm going to pick one out. Do all plans require a PCP and referrals? Cameron, can you speak to that?
Yes, I can. Not all the GIC health plans require a PCP. Any of the plans that are an HMO or a POS plan do require a PCP designation. PPO plans, as well as the Unicare plans, do not require a PCP to be designated, although it is encouraged. And so the new Access America, because it's a PPO, also does not require a PCP designation. Now, the Health New England plan, while it requires a PCP, you do not have to get a referral. It's the only plan where that holds true.
Thank you.
Thank you. And I have a general question about if we can clarify after annual enrollment when this new coverage will take place and if that applies for all of these plans, including pharmacy and FSA and for those who are eligible for GIC dental vision.
Yes, so July 1st is the date when the changes that we've walked through here today will take effect. I would just note that for several of the benefits that were mentioned, they are not changing. So dental benefits, vision benefits, life insurance benefits, those are not changing. But the other changes that we've walked through will be effective on July 1st of this year.
Thank you. And it looks like we may have some members who missed this question, so I'm going to ask it again. If you have a dependent who lives outside of New England, but you, the enrollee, reside inside of New England, what plan options are available to you and that will offer coverage for your dependents? And can you clarify if that's beyond emergency coverage?
Yeah, Paul, can you take that one again?
Sure. Maybe if I give some examples, this will help. The plan that the member can enroll in really depends on where the member lives. So if the member lives within New England, there's several plans available. Unicare Total Choice, Unicare Plus, Unicare Community Choice, Mass General Brigham, Health New England. All of those plans are based in New England where the member lives. If they have dependents that live outside of the health plan service area, so outside of New England, the best option would be to call the plan for out-of-network services. In some cases, some of these larger plans like Harvard Pilgrim Explorer, Plus, Total Choice, have networks that dependents can use while they're outside of the health plan service area if they reside in another state. So it's always best to check with the health plan on out-of-network coverage for a dependent. But there seems to be a lot of confusion because people think they have to join Harvard Pilgrim Access America if their dependent lives out of state. That is not the case. If the member lives within New England, all of the plans that are in the guide, there is a map that's available to the member while they live in New England. Harvard Pilgrim Access America is not available to members that live within New England. If the member lives outside of New England, Harvard Pilgrim Access America is the only plan that the member can enroll in. So it's really dependent on where the member lives, not the dependent. That's how you determine what plans are available, and you contact the plan directly for dependent out-of-area coverages.
Thank you. And along the coverage lines, we have another question of if you reside within the US, if your permanent residence is within the US, but you want to be covered for non-emergency services overseas, would you be able to enroll in total choice.
Paul, you
So
want to
if you
take that
travel
one?
frequently outside of the US and want to ensure that you're covered.
Nope. If I'm sorry, where does the member live?
I think, Cameron, they just live within the US, but they travel. So it really depends on the plan, I think, if you want to.
Yeah. You know, if you travel internationally a lot and you live in New England, total choice is an option. But if you live outside of New England, the only plan available would be Access America.
Thank you. And where can members find information about ancillary benefits such as plans that will cover gym memberships and those types of additional benefits?
Yeah, so those benefits will vary to some degree across all of our plans, but as a general rule, our plans offer those types of benefits. That would be a good thing to understand by going to each of the health plans websites to understand more details.
Thank you. And this may be a good question for Paul. Is there an age limit for dependent full-time students?
Full-time students are covered under the GIC up until age 24. However, at age 24, even if they're no longer a full-time student, we will cover them till age 26. So full-time students get student coverage up until age 24, but at age 24, we do extend the coverage to age 26. Under ACA, all dependents are covered up until age 26. And when a dependent is turning age 26, just for clarification, the coverage ends on the last day of the month in which the dependent turns 26.
Thanks, Paul.
Thank you. And can you talk again about the difference between a PPO and a POS plan?
Yeah, so I did respond to that one in writing in the Q&A. So the difference relates to how you access your out-of-network benefit. A PPO plan, a preferred provider organization plan, allows lower copays and deductibles when you see an in-network provider, higher copays and deductibles when you go to an out-of-network provider. A POS plan also offers in-network and out-of-network benefits in the same way, but you need a referral to the out-of-network provider in order to access the lower cost sharing. It's a little complicated, but they are very similar with the exception of the referral component.
Thank you. And sorry, as the questions still come in, I'm giving some time to answer. If we can have Paul, I think, go over one more time. We still have a number of questions on what members should do if they are having trouble with their PIN to access the MyGICLink portal.
If they're still having trouble accessing the MyGICLink portal, you can contact our office at 617-727-2310. And we have members in the public information unit that can assist members registering for the portal. We also have a GIC online contact form. If members want to complete that on our website, you can complete the online contact form. Send it in to us. It'll ask for your name, phone number, and best time to reach you, and you can put your question in the online contact form, and we will also reach out to you when we receive that form.
Thank you, Paul. And I do see questions about if these questions will be available. We will be compiling a frequently asked questions list after all of the webinars are completed and posting that to our website. We will be compiling the most frequently asked questions, and we do again want to protect any member privacy, so we will be going through and removing questions that contain personal information. If we can go back to the dental slide, and Matt, can you talk again about there's some confusion about who is eligible for dental benefits with the GIC, and perhaps who a member should contact if they are not sure.
Yeah, for that, I may ask for some assistance from, I think it's
can help.
Cameron McBean, who's managed that relationship for us. Cameron, can you speak to that?
I can sure try. What was the question? What are the differences between the two plans?
Yes, and I think I may have heard Paul.
I can chime in
Speak
too if
up
you want to, so it's fine.
Yeah, go
Sure.
ahead.
The main differences between the two plans are which providers do you utilize. If you are happy or able to see dental providers within the MetLife network, the PPO plan offers the same benefits as the indemnity plan. If you go outside of the network, the indemnity or classic plan will offer more comprehensive and slightly richer benefits than the PPO plan. That is the main difference between the two.
And Emily, if you want, I could probably speak to the many different benefits about GIC dental plan too, because I think there seems to be some confusion because the Commonwealth, as well as cities and towns, have many different dental and vision plans. So that seems to always be a question where we get a lot of confusion.
Yes, Paul, that would be great if you could address that.
Sure. The GIC dental and vision plan is available to managers, constitutional officers, or members who do not have access to collective bargaining benefits. So it's a very limited plan and it's only available to a select population. It's about 9,000 people that are eligible for that plan. Many universities are in the higher education system in Massachusetts. They have their own dental and vision benefit through the university. Many housing and redevelopment authorities that are covered with the GIC, they're not eligible for GIC's dental and vision plan and may have a plan available directly through their employer. Municipalities are not eligible for dental vision through the GIC. We only provide health insurance to the cities and towns covered by GIC. So it is a small number of people that are eligible, mostly managers, constitutional officers, and people who are not covered by collective bargaining. Otherwise, it is either through your city or town, higher education, or directly through your authority or some benefit offered through your employer. It doesn't mean it comes through the GIC. I see a lot of questions regarding, is this changing to Cigna? I currently have this plan. Is it changing to Met? The current vendor for GIC is MetLife. All of the other employers and benefits offered through collective bargaining can have different vendors, and you should check with your employer regarding those benefits.
Thank you, Paul. And can we go back to the plans? And we have questions about which plans require a PCP. Do all of the plans require a PCP?
No, not all of the plans require a primary care provider designation. The Unicare plans do not require it. Access America, the new nationwide plan for residents outside of New England, does not require a PCP designation. And while Health New England, which is for residents of Western Massachusetts, they require a PCP designation, they oddly enough do not require referrals for specialists.
Thanks, Cameron.
Thank you for that clarification. And as we near the end of our time, I'm giving those who are answering questions in the Q&A function some time to continue answering those. Matt, if you can speak again to the difference between broad and limited network plans and which plans are fall under which categories?
Yeah, the broad network plans, again, offer the widest choice among providers. So that would be doctors and hospitals. They tend to have a higher premium. The limited network plans, by definition, have a smaller network of providers. They tend to exclude the most expensive hospitals and doctors, but in exchange, that also comes with a lower premium, lower copays, and lower deductible.
Thank you, Matt. And I do see a number of questions about the benefit guides again, and I want to again remind everyone that for active employees, benefit guides will not be mailed to you this year. So we encourage you to go online to mass.gov/GIC to view the benefit guides. And there are multiple benefit guides. So the purple benefit guide is for active employees. However, you will want to make sure you're reading the title. If you are a municipal employee, there are other benefit guides. And again, for municipal employees, you will also want to contact your city or town about your rates. And again, all of the information from tonight will be available on our website, as well as a frequently asked questions document that we will compile. And we have also provided links to many of these in the chat, including to the YouTube and to the our website. And as we're nearing the end, I think we do have a number of questions asking where members can find information about retirement for those who are contemplating retirement, which can be found on our website. We did hold retiree specific sessions, and I believe Mike also shared a turning 65 for the members who are turning 65 link, and you can find more information on our website. Thank you, Mike. And I see Mike is reposting those links now if you're looking for them. Again, as we near the end, just giving our members time to answer, our staff time to answer the questions.
We've gotten a lot of questions today. We're doing our best. We've got to almost 300 of them, but we're still hammering away. And if we don't answer your question here, you can feel free to reach out to us on our online contact form. Maybe you can bring that up, Leslie, that slide, one of the question slides that has that link. There you go. I see a question, were the guides mailed to retirees? The answer is yes. Right, Emily?
Yes, yes.
So this presentation is about active employees. If someone's a retiree here and you might want to watch the video that we did of the session we did for retirees last week. All right, we are at just about at time here. I want to thank you all for joining with us today. Again, this is a great session a great year to really pay attention to your benefit guides. There's a lot of information that will be coming to you. In addition to the benefit guides, your health plan will be reaching out to you. And again, always feel free to use the GIC website. There's lots of information there. So I want to thank you all for joining us. We will hold 2 more sessions in the coming week and a half. If you want to watch it again or you want to engage with us again, feel free to register. And thank you so much for taking the time, and have a good evening.